Looking for a brighter, more beautiful smile? St. Francis Community Hospital, Kasarani has you covered. From Monday, the 30th of September to Friday, the 4th of October 2024, we are hosting a free medical camp. Get life-changing cleft lip and palate surgery because everyone deserves a beautiful smile. Plus, we are offering subsidized plastic surgery services including reduction mammoplasty, gynecomastia excision, keloid excision, burn wound care, advanced wound care, contracture release, syndactyly release, skin grafting, PRP injections, breast surgeries, reconstruction surgeries, weight management procedures, and much more. Hurry and book your appointment before the 23rd of September 2024. For more details and inquiries, call 0793 468 184 or 0112 466 501. The free medical camp is brought to you by St. Francis Community Hospital in partnership with the Kenya Society of Plastic, Reconstructive and Aesthetic Surgeons, the University of Nairobi, and Smile Train. St. Francis Community Hospital, because everybody deserves a beautiful smile. Stay tuned to Capuchin TV, your Catholic identity.
Enjoy this conversation with me, Maureen Kimani. Welcome to this exclusive interview coming to you live from St. Francis Community Hospital in Kasarani, as we bring you a very exciting and fascinating conversation about the hospital, its journey onto serving the community when it comes to healthcare. And while as Capuchin TV, we love to say that your health is your world. And today we shall dive into this conversation about how St. Francis Community Hospital is helping and taking care of the community in terms of healthcare. And joining me right now, we have Sister Esther Mwangi, who is the CEO of the hospital, but she's going to tell us more about herself and the hospital as we engage in the conversation. A very good morning to you, dear sister.
Good morning to you.
How are you doing?
I'm fine.
You look good.
Thank you.
Yeah,
you
beautiful, natural.
Thank you.
Thank you very much. It's good to have you here, and thank you for making time and for inviting us as Capuchin TV to come here in your premises to have this conversation.
You're welcome.
Yeah, thank you. But for the person who's watching you for the very first time, could you kindly introduce yourself, tell the viewer who you are and how you feel to have this conversation with us?
My name is Sister Esther Mwangi, as you've correctly put it, and I belong to the congregation of the Little Sisters of St. Francis. The Little Sisters of St. Francis was started in Uganda in 1923, a place called Nkokonjeru, which means white hen, and our founder is Mother Mary Kevin Carney. She was an Irish missionary, Franciscan missionary for Africa. She started with 8 girls, and now we have grown. We are 828 sisters who are alive and working in different countries. Our strongest base being in Uganda. In Kenya, we have close to 300 sisters, and in Kenya our formation house is in Nakuru, Bahati. That's where we are all formed, and then from there we are sent to different missions, and one of the missions that we are having is the Little Sisters presence in Kasarani. So Kasarani is the headquarters. We have 2 headquarters kind of in Kenya, east of the Rift Valley, which is based in Kasarani. We have our regional superior sit here and all the administration. Then we have west of the Rift Valley, which is in Bungoma Regional House, and that's where the other regional superior sits. So within the east of the Rift Valley, here we have different ministries. Among them is hospitals. But in addition to hospitals, we also engaged in very many other apostolates. We do education at all levels, from playgroups to university to, yes. And then we are also involved in social ministries. They are very, very dear to us, and it was also very dear to our mother foundress, reaching out to those people who are really down in the villages, those that St. Francis loved, the poor. And then here we come now to the healthcare services. And for now, we are at St. Francis Community Hospital, Kasarani. It's a level 5 teaching and referral hospital that takes care of tertiary healthcare, which means we are taking care of patients at advanced level. And therefore, the services that we have here are from immunization, the basics, to mothers coming for antenatal clinic, to very complex surgeries, including surgeries in neurosurgeries, orthopedic, we have laparoscopic surgeries, we have obs-gyn clinics, we have specialized they're called physicians, the people who, yes. We have cardiovasculars are the ones who take care of the systems, the circulation system. We are now beginning up a clinic for cardiology. We have wound care services that are handled by specialists. We also do mental health, so we have people with psychiatry issues or mental health conditions. We have specialist doctors and nurses for that. And then we also have very, very dear to our heart is the pediatric services. We have a very good pediatric doctor. We have pediatric surgeons. We have also the intensive care unit that takes care of pediatrics. So they are called NICU in the hospital language. So the newborns and the pediatrics, we have an ICU for them, in addition to the normal ICU. We also have places for executive services. Patients who want to have some privacy in their treatments and in their care, they are also in place. And we also have a training school. So this is also a teaching hospital. It is an internship center for medical doctors. It is an internship center for registrars. These are people who have advanced in their trainings. And then we also have MOUs with different universities who bring their students here for learning and for mentorship and for all practices. So in a nutshell, this is St. Francis, which is basically a level 5 teaching and referral hospital. We work with very many insurance and partners, so that it eases up the care and especially the financing part of it. We also lucky to have great partnerships in the community with different churches, with different organizations, and with that it makes our partnerships and our collaborations very good in accessing patient care. We value feedbacks, and through feedbacks that's why we've been able to grow and to know what our strengths, what are the areas that people are looking forward to our services, and we pay serious attention to it. So that is Sister Esther with the Little Sisters and St. Francis Hospital. Yes.
Right. Wow. What a beautiful introduction about yourself and, of course, the hospital itself. And I loved that you were able to mention some, overview of what are some of the services that the hospital offers in terms of promoting a better healthcare to the community. And congratulations, by the way, to St. Francis community as well. And you mentioned about feedback to you, dear viewer. You are watching us. If you'd love to have a question on how you can get in touch with St. Francis Community Hospital, you can definitely reach out to us on 0717-424-866, or you can use the SMS number 21760. That is for the Capuchin TV. And of course, before we end the interview, we shall give out the hospital numbers as well, so that you can be able to get in touch with them to come and access these medical services they have. Well, sister, maybe you can tell us, how has the journey been serving the community to promoting a better healthcare? Because we understand that health is very crucial to every person at any point. Could you kindly tell us?
The journey has been long but also very interesting. started settling in these areas, actually the viewers need to know that the sisters were the first ones to settle in this Kasarani. When there were no other people, there were no matatus, the road was not even tarmacked. So the easiest they could get was at Roysambu Shell. There's a Shell petrol station there. That's where they would alight and then walk up to this place. There was no church around, so they could only go to St. Dominic Muiki for Mass or go to Queen of Apostles Seminary. But when the sisters settled, their friends were thieves, mosquitoes and bushes. So it was so scary for anyone to live here. But they had the resilience of being on mission. At that time, when they started settling and with people being very far off, we started by first gathering a community of prayers. People would gather and pray together with the sisters because they know where sisters are. There'll be time to pray, and also there will be Mass. Priests coming to celebrate Mass for us, and so the community will join us. So slowly we started a school, and that school was a baby school. They're called kindergarten. So we started taking care of those children, and then the numbers started growing. And when the sisters settled, then the community began having the confidence that where sisters or where the church is, there will be church, there will be a school, there will be a hospital. Those are basic things that in life everyone wants to look forward to. So when the sisters settled in 1980, I think it was 89, that's when they started coming. In the year 1993, we had just 3 classrooms. So when children began growing in numbers, we moved the school. It's now called Mount Lavena School. It's a big school with thousands of children from kindergarten to high school. And then now it is in the same 2 rooms that we started the clinic now, the clinic for mothers and babies. And then from there we went to maternity services. And then in the year 2009 is when we opened this St. Francis as a level 3 hospital, where now we at least had 1 theater. And we started seeing patients who are now getting admitted. Before it was just an outpatient. And then since then we have registered milestones in responding to patient needs. When they come, they will ask us, now they are asked, when they come, they ask us more about cancer services we don't have. So, but now it's great because in this month, the coming new month, we are going to open up cancer services. So we grew with the needs of the community up to where we are. We started with maybe as low as nurses, then we had clinical officers, then we had medical officers running the hospital. Now we have specialists, and not just specialists. We've gotten to subspecialists. Now we have the best nephrologists in town. We have the best in plastic and reconstructive surgeries. We have the best in ophthalmology. When you come here, you can get a doctor who is able to review you and treat your eyes. We have the best of art dental services. And as I told you, we also take care of dermatology. There are many conditions. We also have a very vibrant TB, HIV clinic. And this has served very many patients, and so many people have benefited from that. And actually the TB services, we call them home-based care services. We are offering them free of charge, courtesy of many other people who are partnering with us. And growing up to a place of where we can be able now to do orthopedic surgeries, very complex. I've seen very many good friends of ours from the neighborhood, Nairobi County, Machakos, Kiambu, and the environments. They really love our hospital for orthopedics. So we have a professor who takes care of very complex orthopedic-related conditions. And of course, also the coming in of a neurosurgeon has also been great news to our patients, and they're happy about it. So that has been the journey. Even now getting to a teaching hospital where we have our nursing school. Remember, we started from a nursery class. Yes.
Well, what a beautiful journey, and it's quite interesting seeing the milestone that you have caused, leaving a landmark and not only serving the Kasarani community patients, even people, but even beyond, because I understand that you do outreach programs as well.
Yes. We are very passionate about outreach programs, and the reason for the main drive and motivation for doing outreach, we know we have the skills, we have a specialized team, also with our part as a mission, we have always to fulfill that mission. And our mission is reaching out to those who may not be able to reach us because of one thing or the other. Others might not be able to reach us because of the geographical setup, they are a bit far. Others will not reach us because when they come to the hospital, sometimes it could be expensive because they have to meet the cost. So once in a while, like every month, we have to prepare an outreach where we also ask our suppliers and many partners who love us to also sponsor the events. For example, if a sponsor gives us some things to do with blood sugar testing, we're able to go out and do blood sugar. So we look for partners. And when we go out, we reach out to so many people. We're able to do very many free services when we go to the community, because also our staff select volunteering and giving their services. So you will find that this year alone, we've been able to reach out to more than 10,000 people for the outreach camps. And we've been going to Gatondo, Kiambu, we have traversed so many places. Kasarani, we have done it in this hospital. We've also done it in many other Protestant churches, like SEK is one of our very good partners. They invite us. This Saturday we'll be going to a church called Muihoko. It's a Catholic church. They also invited us for an outreach camp. And we've seen transformation and a lot of appreciation. There's also a time when we had a doctor strike. You can imagine the magnitude of the healthcare needs that were there. So we were able to get to the community and to help them, and those mothers, many people really bless us for that. And therefore, despite, we also want to give to the community. Despite that, the fact that we have to continue running a hospital, but we still remember there are people there who might not be able to reach us. We reach out to them in one way or another. Every month we must carry out an outreach. Yes. Okay. With dental services, with eye services, hypertension, diabetes, physio, nutrition. All, actually, we go like a whole hospital. We have to get a van of about 30 staffs to get out for community outreach. Yes.
Wow. And actually the reason why I mentioned about the outreach program, Gatondo is my hometown, and I had information Kasarani people walishafika pale, and umefika po. Yeah, and it's a good thing seeing that you are even putting that effort to go out to make sure that everybody is getting this chance of, getting services when it comes to their health matters. So congratulations. Yeah.
Reached out to groups of CWA. They invited us in Githunguri, and also Gatondo are planning for something, and they come out in big numbers. So, and they ask us to take the best of the doctors, and that we have done. Thank you.
All right. Thank you very much, Sister Esther, for sharing those beautiful insights as we go on with our interview. Let's talk about now the initiative for free, this surgical camp for cleft lip and palate surgeries.
So this is something that is very unique this year. We have not been able to bring such very crucial services to the people around here. And when the Kenya Society of Plastic and Reconstructive Surgeons approached us and requested us, can you host this function this year? We were more than delighted, because we are a community hospital. So all the time we look for the best opportunity to give something to the community. And therefore, when partners like, they are called Kiss Plus and Smile Train, they also approached us. By then they came for a very serious assessment to check that the hospital is so well equipped with personnel, with equipment, with the way our procedures are carried out purposely for patient safety. We were very happy for that exercise, but you can imagine what an audit does. An internal audit for that makes you become better. So when they came and they told us we are equal to the task, we were very excited. So we planned for this together with the St. Francis Hospital, the University of Nairobi doctors, and many other volunteers and partners. So what we are doing is all children who are born with cleft lip and cleft palate, that is, they are described as children who did not, when they were growing up in their mother's womb, their mouth did not close well. In simple terms, people will call a gap. There's a gap on the lip, a long gap looks like a furrow or a mtaro, and then we have yes,
some pictures.
some pictures of the same.
I have a very image and the poster of that.
Then those others at the palate, at both the soft palate and the hard palate. The soft palate is near the throat, and then the hard palate is here. So the tissues have not joined. So there's like a very big gap, which makes children not be able to suckle well. They don't have, because you have to use your palate for sucking and your lips. So when it's not there, it means the child is not able to breastfeed very well. They are not able also to speak, because their speech, you realize you use a lot of your muscles along the cheeks, the lips, the palate to speak. So they'll not be able to speak well. Sometimes they also find the challenges of being choked, because once you are feeding them, the food can easily regurgitate through the nose, and therefore these children have got a big problem, and they are born like that. So it is like, we call them congenital malformation. This surgery, most children cannot be able to afford. So partners and people of goodwill, they have come together, and we've mobilized countries. What you need to know is that in our course of mobilization, we have even gotten inquiries outside the country. We've gotten a lot of inquiries from South Sudan, and we see, actually in this hospital, we see very many patients from South Sudan. So we have registered children in, like now, those who are likely to benefit from the surgery. For now, we have registered over 150 children. So, but another screening will be done on 29th of this month to ascertain those who are now eligible. Eligible means they have to not to have other diseases that can compromise the surgeries. They have to be of correct weight and age. So we are looking forward to children who are 3 months and have got 5 kilos and above, so that they can withstand anesthesia. And they don't have other, we call them comorbidities, any other condition that might make it delicate for the child to go to theatre. So we have planned for their free accommodation. So St. Francis will be giving accommodation to ensure when they come, they have a place to sleep, they are eating well, their hygiene is taken care of. They also get a nutritionist to guide them all through. Even on the screening day, we have 2 resident nutritionists. And then we have surgeons from Kenya Society of Plastic and Reconstructive Surgeons who will be doing the surgeries. Smile Train will also be here with us. Doctors from university on the ground. So we look forward to help these children smile again and support them. Yes.
All right.
So the camp starts. The camp starts with the screening on 29th, and surgeries go on from 30th to 4th of October. And 4th of October is also St. Francis Day, which we are very happy about.
Okay, yes. And I know I think we're going to take a very short break, but when we come back, you shall tell us more about what happens for the 4th of October, and why is that day special to your community as well. Okay, we'll be looking forward maybe for an invitation as well. Okay.
For all Franciscans in the world.
Awesome.
Yes.
Awesome.
Yes.
All right. And by the way, I loved the fact that you brought this notion of everyone deserves a beautiful smile. What a beautiful way to, build that confidence of that child and self-esteem as they continue to engage in conversation with other people. When you have a beautiful smile and you get compliment, you feel amazing. And actually by now, there's someone who said you have a very beautiful smile.
Oh, thank you. It feels nice. Yeah. You too.
All right. Thank you.
And not just that, we will also onboard a speech therapist, because you realize these children now have also a delayed milestones in their ability to speak. So there will be a speech therapist who will be journeying with them. Yes.
All right, and that is our sister Esther, who is the CEO of St. Francis Community Hospital, and we are having a conversation about the hospital. What are some of the services that they offer, and how can you come in here and get these beautiful services that they have? And we're going to take a very short break, but when we come back, we shall continue with a more conversation about the way it's promoting, the way the hospital is promoting a better health care to the community. Stay tuned for that.
Thank you.
Looking for a brighter, more beautiful smile? St. Francis Community Hospital, Kasarani has you covered. From Monday, the 30th of September to Friday, the 4th of October 2024, we are hosting a free medical camp. Get life-changing cleft lip and palate surgery because everyone deserves a beautiful smile. Plus, we are offering subsidized plastic surgery services including reduction mammoplasty, gynecomastia excision, keloid excision, burn wound care, advanced wound care, contracture release, syndactyly release, skin grafting, PRP injections, breast surgeries, reconstruction surgeries, weight management procedures, and much more. Hurry and book your appointment before the 23rd of September 2024. For more details and inquiries, call 0793 468 184 or 0112 466 501. The free medical camp is brought to you by St. Francis Community Hospital in partnership with the Kenya Society of Plastic, Reconstructive and Aesthetic Surgeons, the University of Nairobi, and Smile Train. St. Francis Community Hospital, because everybody deserves a beautiful smile.
Everyone, welcome back to this conversation that is coming to you live from St. Francis Community Hospital in Kasarani, as I will delve into how the hospital is promoting better healthcare to the community. And joining me right now, in case also as to you, dear viewer, in case you are joining us right now, we are joined by our Sister Esther Mwangi, who is the CEO of St. Francis Community, and as well we have a very beautiful cat here with us, yes, as we continue to engage in this matter concerning health. And Sister, welcome back to our second part.
Thank you.
Yes, and before we had gone for the break, you were very excited to talk about this day that is 4th of October.
Yes.
Could you kindly now have that space and tell us more about it? What is it going to be happening, and why is that day special to you as a community?
4th of October, it's a very exciting day for all people in the world who are associated with St. Francis of Assisi, those who are following his charism, those who are following his teachings, those who love him, and including our Pope. Our Pope Francis chose the name Francis because he's inspired so much by St. Francis. So St. Francis of Assisi is this wonderful, amazing man who lived in the 11th century, and he loved peace. He was a man of peace. He advocated for peace. Even he has a prayer for peace that is loved by very many Catholics. The St. Francis prayer for peace. St. Francis is this person who loves environment. He is a saint who you would speak to animals and they would listen to him. He is a saint who he would even preach to birds, to fish in the air. He said he's one of the saints who was so much like Jesus in all ways, including getting the 5 wounds. 2 days ago, on 17th, we were celebrating his memorial day of having the wounds. He got the wounds of Jesus. So he's the same saint. He was also a saint of, he's a very happy person. When we went for formation, we were told there's something called Franciscan joy. So when you are following up in the footsteps of St. Francis, he was a happy person. He was youthful. He would play around with people. He was a very happy person. So St. Francis is whose spirit we are founded on. And with that, that's why this hospital is called St. Francis Community Hospital. So it's inspired by the life of St. Francis. So our Archbishop, Most Reverend Philip Anyolo, will be coming. The Metropolitan Archbishop of Nairobi will be hosting this day. He's confirmed he will come very early in the morning. So all our staffs are so happy. We've invited many people that we work with and are very close friends to this facility. And so on that day, what will be happening? That day, we'll be launching very important service that we have not had, that is a bit special from what we've been doing in the past, or that's a bit advanced. So, and these services are the cancer and palliative care. We have come to know that there are so many people out there who need palliative care. So palliative care are people with very chronic conditions, or they are called chronic, yes, febrile, or very sick, and long-term diseases. And these people, they are living in a lot of pain. They need closer care and monitoring. They need to be given a lot of love and dignity. And if St. Francis was here, he would remind everybody to take care of palliative. And also we take care of people as, they're called end of life, like end of life. And end of life does not mean that they will have to die, but it means their life is very, very delicate, and by all medical outcomes and medical care, or what the doctors advise, is that this person can only live with this condition, and we support them in that condition. So be it people who have got very serious diabetes, people who have cancer, people who have heart diseases, people with that long-term disease. So they are the ones, we have designated a very nice wing that will be treating them, where spiritual care will be very key. So our priest in the chaplaincy department will join with them. We have trained nurses who will know how to take care of people who are very sick and delicate. We also have a team of people who are specialists in reviewing them and ensuring that at least they are living with dignity and without much pain. So we'll also be launching our chemotherapy unit. We were not able to, before then, we could not manage to prepare our own chemo and administer to patients with cancer. But now that we have an oncologist, we are putting up an oncology department. And so our bishop will be blessing that department. We'll also be rewarding our staffs who have performed very well. You know, when staffs in any organization, they have good performance. So we've done their performance reviews, and we want to congratulate those who have contributed to the milestones of this facility, and those have made us proud. So that's what will be happening on 4th of October. And also it will be a joyful moment for a family coming together. The family of Franciscans, especially all the sisters who are in this complex, will also be renewing our vows as little sisters of St. Francis on the same day. And we really look forward to the same. And very specially, it's the same day we shall be concluding our free corrective cleft lip, cleft palate surgeries. So even the doctors who will be doing and involved in those surgeries, they will be around to tell our bishop and the world how it was, how it's been. So you can imagine how much we are looking forward to the day. Yes, we even want to start with a novena in honor of the same St. Francis Day. Yes, by 25th of September. Yes.
Beautiful. And actually, it's a good thing that you brought up the closure bit of these medical camps, because I was to mention about that.
The last
the
day,
climax for
so
everything.
We'll have known what happened. We want to tell them. And then the beneficiaries will be giving testimonies. Those who have benefited from the camp will also be giving testimonies on how it has been. Yes.
Okay,
Yeah.
all right. Very nice. It's a very informative session, and I'm loving, engaging with you on this conversation. Let's talk about when it comes to preparedness of the global health outbreaks. For example, we have Mpox in Kenya.
Yeah.
Please, can you tell us how Kasarani, St. Francis Community Hospital, get ready for such outbreaks?
Now, immediately we get to know, the media is sensitizing people that there's an outbreak. The first thing we begin even researching more to understand what this kind of an outbreak. To those who are doing, they are responsible for research and informing and alerting us, especially our specialists, doctors. They sit down and begin looking into this disease. Meanwhile, we also get a lot of educative content from Ministry of Health, from the county, from disease surveillance departments, and those who manage outbreaks. So they will give us protocols. They will tell us what is this disease. They will give us how is it managed. And then based on those, the guidelines, actually we call them the guidelines, depending with the guidelines that were given by the government, And also reading through journals, consulting FAR, we set up a department. We set up a way to handle this. So for our case, what we did, we sent one of our doctors for training, and we told him that he's the champion. So with that, he also prepares training for all the staff members. So what we did, it's called continuous medical education. We had a CME, a whole 3-hour session on our staff being trained on how the disease is presenting, when patients come, what will be of help to them, how do we even prevent it, and educating also the community, how do you protect yourself from this. And if a patient comes with this condition, you even set we call it a different isolation wing for it. And you prepare doctors and nurses who will be specifically managing that patient. And also we are required, if a patient comes and you are suspicious, you do the screening, you also send the same results or specimen to government facilities. And if you confirm a case is positive, you also report to the sub-county health offices. From there, they also take it up like any other outbreak. But so far, so good. We thank God we have not had any case. But St. Francis is fully prepared for it, from our doctors, from the infrastructure. So if a patient comes, where we are going to treat them, and sensitizing them, and also screening. So we are all set for that, but we pray that God contains this outbreak, and that it doesn't come to harm our people, and that we are very free from it. Yes. But if case it comes, we are ready and set. Yes.
People say the future is unknown.
Yes.
You have to prepare yourself.
To be ready.
Yeah, you have to be ready.
We have to be ready.
Yes, for anything. Thank you very much, Sister, for sharing those insights. And we have, as we mentioned when we were beginning with the conversation, we said in case you'd love to be part of this by sharing your insights, or you have any question to Sister, you can definitely share. And we have some here for you, Sister.
Yes.
And there's a person who says this is Trish from Kericho following you.
Okay.
Congratulations, Sister, and your team. You're doing a very good job.
Welcome. Thank you, Tricia. We are humbled.
Yeah. And then we have another question here for you, Sister. I don't know the name, but she says, I have a daughter who needs further her studies from diploma to bachelor's degree in health records and information technology. Do you offer that course?
Not yet. We have not started the health records, but the future is telling us to train such. So as we expand the services we have in our nursing school, we are getting a lot of inquiries on medical records, and therefore that's something that we'll consider in future. Yes.
All right.
And many other trainings.
Yes. Okay. All right. And I can see also people are asking for the hospital's contact.
Okay.
How can they get in touch with you before maybe we wind up on what the future is for St. Francis Community Hospital?
Okay.
Yes.
Thank you. With me, actually, these people are the contacts because we might not be able to maybe to respond everything on the show. And there are those who would want to maybe ask for something else that I did not present, or they want to know about St. Francis or to inquire and get some help. So if they would like to reach us, we have different telephone numbers, mobile numbers, that to ease, so that if you want to inquire about a particular thing, then who do you get to faster? So the first one is the shift manager. So if you want to ask about the services in the hospital, you want to bring a patient, you want to inquire about any clinic or any kind of treatment, it will be answered by a shift manager, and the number is 0741 68 9983. So this number is on 24 hours. There will always be somebody with it, be it during the day, at night, weekends, everywhere. 0741 68 9983. You will get us through that. And then if you want to ask anything that is customer related, we have a customer care desk number, which is 0795 43 1113. Customer care desk is 0795 43 1113. And then if you want to refer a patient, maybe you have someone and you want them to, when they come, there's someone who is waiting for them and has prepared the right, be it the doctor or the department, so that your patient is well received. We call it a referral number. So that one is 011 24 66 501. This is the same number we have given to people who are inquiring about the cleft lip and cleft palate, because it's not as congested. So it is 011-2466-501 in case you want to refer a patient or to come for cleft lip. Then for surgeries, those who want to inquire for surgery related issues, the one who is an expert in this, it is 0793-468184. It's also the same number we are giving out for cleft lip and cleft palate. And therefore, if you want to ask anything that is related to surgeries and wound care, those who have some wounds that are a bit stubborn and they need to be taken care of by a wound specialist, is 0793-468184. And if maybe you want something in the laboratory, there are those who want to check on something in the laboratory, 011-2908-742. 011-2908-742. Yes.
All right.
And those who want to reach out to me through my secretary's number is 0713-969608. Yes.
Okay, and sister, just to emphasize on the medical camp that shall be happening next week, that is from 30th to 4th of October. I can see you have a subsidized plastic surgery services as well. I think you can be able to mention on that, maybe for the person who's watching us. It would have been so unfair
if I did not talk about the subsidized services. You are an angel, because there are people who would have missed this. Now, the same doctors from the Plastic and Reconstructive, the Society of Plastic and Reconstructive Surgeries, they will be camping here for about 5 days. So one thing we also asked them is, can they give free consultation? Because these services are normally very expensive. Most of them, consultation is 3,000 and above. So we asked them if they can offer some free consultation to people who would have some conditions. For example, those reduction mammography is those who are born with abnormally big breasts. And we have very many ladies who are suffering from this. At their teenage, their breasts continued growing. And when you look at them, they also feel it is abnormally grown, and they suffer a lot from the weight, from the stigma and everything. So that's reduction mammography. Their consultation will be free. All this consultation will be free. But in case there will be a need for a surgery, they are going to subsidize in honor of the camp that they will be carrying out. Another one is called gynecomastia excision. This one is for men who have got big breasts as if they are females. They are those who, because of hormonal changes or hormonal tendencies, they get to have breasts. And you see, this brings a lot of low self-esteem to men. So any man who is feeling he has got this problem, the experts will be here, and they can give you free consultation. And if they have to operate on you, they are going to reduce the prices. So we also have keloids, and I've been sent some photos of a child who is suffering from very big keloids. So keloids is things that grow if you have a scar, and they don't stop growing, and they are very stubborn. So they will offer free consultation for this, and in case of excision, they are the experts, they are going to reduce the prices. So those with burns and wounds that have been there for long, they also reconstruct the scars that are due to burns. Contracture release is like you got an accident or you got a burn and maybe one of your joint is not flexing. So the doctors will also be doing that, and they'll offer free consultation and subsidized surgeries. So advanced wound care, I have mentioned that this is a big problem, especially for people with diabetes and low immunity. They can have very stubborn wounds. So again, these are the specialists who deal with it. So take advantage and come. So we have something that is called sendicile release. We have skin grafting. Those who want, like you have a big wound and you need some skin grafting, they will do it. PRP injections, they also do some injections to relieve pain. And they are also therapeutic, they are called PRP, breast surgeries, reconstructive surgeries, and weight management procedures. So these are some of the procedures that are commonly affecting people, but it's normally handled by this category of plastic and reconstructive surgeons, and they have agreed to offer it at subsidized rates during these 4 days of the camp. So if you know somebody who could be having this, please, it could not be you, but it could be someone else who needs it. Pass the message and pass the message. And the consultation will be free. But surgeries, let me repeat again, they will be at reduced rates, discounted rates. Yes.
Okay. Wow. Thank you very much, sister, for that. And I understand some of us, just wait until when we get really sick. That's when we visit the hospital. It's always nice to come and get such a, medical checkup, especially that you have a free, medical camp that St. Francis Community Hospital is offering. Come on, please do that. And you'll be catered, and I'm sure they will be able to walk with you in this journey of health. And while we have Muranga John is talking about SHIF and HIF.
Yes,
just to mention about that,
SHIF and
please.
NHIF, SHIF and SHA now. We are beginning to forget NHIF because it is transiting to SHIF. SHIF stands for Social Health, SHA, Social Health Authority is the one that will be regulating the social health insurance. That is SHIF now. So the regulatory authority is SHA, and then the other one is will come out from NHIF. So registration is going on, and this we are not going back. The government has given us another new platform for this. So people are registering online. And then for us as an employer, we've also started registering our staffs to the new platform. And definitely when this is rolled out in the country, and we are told from 1st of October it will be rolled out. Actually, the authority that is now managing NHIF at this transition time is SHA. And so we, like any other facility, we are a level 5. We will definitely get accredited because we'll continue with what we were doing. And all the services that will be registered and will be mandated to carry out definitely will be in it. And we are fully prepared. We are looking into things that will be sponsored or supported by that. And we have aligned ourselves strategically for us to deliver in accordance with the guidelines that are coming up.
Okay.
Yes.
All right. And someone is asking for clarification. Does it cover the entire medical bill?
Now, the way it is now categorized, you see there will be primary health, the universal health. The insurances, once it is rolled out, I'm sure there's a lot of education that will be done to the public to know which one will be covered fully, which one will not be covered fully. But the good thing with this new model, it's covering more services than they were covering before. What I know now, they will be covering a little bit of the eyes, which was not there before. They'll be covering dental. They will also be covering emergency services. They will also be covering critical care. But the compensation is still something that we are yet to see when we get there. Yes.
All right.
Yeah.
Thank you very much. And I just to the viewer, in case you have any other question that you'd love to address to the hospital, please do reach them out on the numbers that shall be down below on our screen as Capuchin TV. We shall make sure we leave them there so that you can be able to get in touch. Sister, I know our time is up. Please just do your parting shot in less than maybe 1 minute.
1 minute.
Yes.
Thank you, Capuchin TV, for just coming on time, where we are preparing to celebrate St. Francis Day, and also for coming to make our viewers and the friends of St. Francis Hospital to get to know about the free surgical camp that is coming to help very many children in Kenya and beyond. Thank you for also letting the world know who St. Francis is, St. Francis Community Hospital is. I also want to celebrate all lovers and loyal customers of this facility. We get very many people who watch Capuchin TV, and they're friends of this hospital. Our Catholics, wherever you are, many Protestants who are also friends to this facility, the Capuchin is highly viewed. Even in the ward, our patients tell us to put on Capuchin TV. Wow. Because it builds, it helps them connect with God, and it's a TV that will evangelize to them in many ways, and the beautiful songs that play, it's something, and also covering the many events that you cover. So St. Francis is always watching, and St. Francis is a home. When you come and you want to give us feedbacks, tell us how we can get to you, and we are always open. So this is a hospital that loves people, and our staffs are very friendly. They are very competent. If you listen to us, we try to hire the ones who are highly competent, and we keep on training them. Like every Friday, education must be going on. They must take 1 hour to learn and train and improve on something. Every Wednesday is mandatory for everyone. So you will be safe in St. Francis, and we can handle as any complex procedure and any simple procedure that it is. Thank you so much, and please support and pray for St. Francis and celebrate with us St. Francis Day.
Well, beautiful remarks there from Sister Esther Mwangi, the CEO of St. Francis Community Hospital here in Kasarani. Thank you very much to you, dear viewer, for tuning in and keeping tabs with our conversation today. This was a very special segment, just as Capuchin TV are concerned about your health, and we continue to say that your health is your priority. So make sure you take care of yourself, and just to say thank you to the Capuchin TV crew who were behind the scene, starting with Alan and Diva, Venanzi Unganga, Eric Otieno, Justus Okari, and we have Anthony Mulama, and not forgetting Peter Mwangi on the other side of the studio. And also thanks to Cosmos Omondi for organizing this interview, making sure that we engage and we reach out to a very high number of the viewers and the people who may be able to benefit from these services the hospital is offering. My name is Maureen Kimani, and thank you very much to all of you for this segment and for making it happen. May God bless you and have a blessed day. All right.
Looking for a brighter, more beautiful smile? St. Francis Community Hospital, Kasarani has you covered. From Monday, the 30th of September to Friday, the 4th of October 2024, we are hosting a free medical camp. Get life-changing cleft lip and palate surgery because everyone deserves a beautiful smile. Plus, we are offering subsidized plastic surgery services including reduction mammoplasty, gynecomastia excision, keloid excision, burn wound care, advanced wound care, contracture release, syndactyly release, skin grafting, PRP injections, breast surgeries, reconstruction surgeries, weight management procedures, and much more. Hurry and book your appointment before the 23rd of September 2024. For more details and inquiries, call 0793 468 184 or 0112 466 501. The free medical camp is brought to you by St. Francis Community Hospital in partnership with the Kenya Society of Plastic, Reconstructive and Aesthetic Surgeons, the University of Nairobi, and Smile Train. St. Francis Community Hospital, because everybody deserves a beautiful smile. Stay tuned to Capuchin TV, your Catholic